KPOA 93.5 FM here on the Aloha Morning Show. And it's the first Thursday of the year. And at this time here on the show, we talk with our friends from Maui Health. I want to welcome to the phone line from the Maui Memorial Medical Center Wound Care and Hyperbaric Therapy. She's a registered nurse and program director, Jessica Acop. Good morning, Jessica.
Good morning. Happy New Year to you, Shane.
Happy New Year. Good to talk to you again. Jessica, our first question from one of our listeners is a good one. They say, I've been diagnosed with pre-diabetes. Can I reverse it?
That's a really great question, Shane. So if a patient or if someone has been diagnosed with pre-diabetes, good news is you can actually reverse it. So let's just get into pre-diabetes means that your A1C, or what we call long-standing blood glucose, is below or is above 5.7. So if your A1C is 5.7 to 6.4, that means you can really reverse this. The good thing is that you just have to make little changes with your lifestyle, like adapting a more active lifestyle, maybe walking around the beach in the morning. Think moderation with regards to eating. So not so much Spam Musubis, not so much Kinder Buenos, not too much sugary foods especially. So that's the really good news about patients who are diagnosed with this.
Okay. What is hyperbaric oxygen therapy?
Ooh, that's a really exciting question, too, because we do have hyperbaric chambers here at Maui Health now. So hyperbaric oxygen therapy is technically a treatment in which a patient goes into this chamber that looks like a spaceship. So it's a really exciting new thing that we have. The patient breathes in 100% oxygen inside the pressurized chamber, and the hyperbaric dose of oxygen helps your blood carry more oxygen to your organs and tissues, and this will promote wound healing. Also, it activates white blood cells to fight infection. We do treat patients here at Maui Health Systems or Maui Memorial in the hyperbaric chamber for patients with slow to non-healing wounds. We do treat patients with diabetic foot ulcers, also patients with symptoms occurring on, around, or point of radiation, like for cancer patients. Any radiation pain, rectal bleeding, bladder bleeding, or a wound caused by radiation.
Got it. And speaking of the oxygen therapy, what qualifications are needed for someone to receive the hyperbaric oxygen therapy?
So there's a few conditions or types of wounds that would qualify you to see a wound care specialist or get into our hyperbaric chamber. Like I said, a couple of those earlier, those are if you're diabetic with lower extremity wounds or ulcers and it's not healing. If you have any radiation wounds, if you have any rectal or bladder bleeding after radiation around your cancer site, you can definitely qualify.
Got it. Some great answers this morning. Jessica, thank you for calling us this morning. And great talking with you again. We'll do that again sometime in the future. And Happy New Year.
Thank you so much.
Aloha, Jessica.
Happy New Year, Shane.
Bye-bye.
Aloha.